We all know that pre-baby flutter of nerves, right?
Right, yeah,
That moment you think, wow, this is really happening. It's pretty much universal.
definitely.
But imagine that flutter just amplifying, becoming this relentless storm, a really deep, abiding fear of childbirth that can actually take over your thoughts.
And that intense, overwhelming fear is exactly what we're focusing on today. We're going deep into tokophobia.
Tokophobia, right?
Yeah, it's a condition that isn't just about the usual worries around childbirth. It's a significant phobia. It can really impact a person's life, their decisions, everything.
And what really jumped out at me from our sources was just how many people are affected. Something like 14% of pregnant women experience tokophobia.
It's a huge number.
Think about it. That's a really substantial group facing this intense level of fear. It's far beyond just, feeling a bit anxious.
It is significant. And it's important to realize that while the experience itself isn't new, the sort of formal recognition, getting it into the medical literature as a distinct psychological issue, that really picked up around the year 2000.
Okay, so relatively recent in medical terms.
Exactly. So in this deep dive, we really want to unpack what tokophobia actually is, get a clearer picture of its prevalence, maybe explore some of the factors behind it, and definitely look at how it's being understood and, importantly, addressed.
All right, so tokophobia, it's a specific phobia related to childbirth. When we say specific phobia, what are the key things that make it different from just like normal anxiety?
That's a really key distinction. A specific phobia involves this persistent, excessive, and kind of unrealistic fear of a particular thing or situation.
Childbirth in this case.
Right, childbirth. It's more than worry. It actually triggers a powerful anxiety response, often difficult to control, and it can lead people to actively avoid the situation.
Avoidance, okay.
Yeah, and you might see other names for it too, like tokophobia, myusiophobia.
Myusiophobia, that's a mouthful.
It is. Comes from the Greek myusis, meaning midwifery. Then there's parturiphobia, from the Latin parture, to be pregnant, and even lochiophobia.
Wow, lots of terms.
But they all essentially point to the same intense, focused fear around the act of giving birth.
So it's definitely not just a feeling. It has real, tangible effects. What kinds of symptoms might someone with tokophobia actually experience?
Well, the impact can be pretty significant, and it shows up in different ways. Our sources mention things like recurring nightmares, specifically about childbirth.
That sounds awful.
It does. Also, a noticeable difficulty concentrating on just everyday stuff because this fear is just so present. Overwhelming panic attacks can happen too.
Panic attacks, wow.
And even what we call psychosomatic complaints. Physical symptoms like maybe persistent nausea or headaches that don't have a clear medical cause, but seem directly tied to the anxiety about birth.
So feeling physically ill just from the thought of it.
Exactly. Imagine that constant burden.
It's also really interesting how this deep fear can shape major decisions, like how someone chooses to give birth.
Absolutely. That level of fear can become the main driver behind requesting an elective C-section.
Right.
And it's not always just about avoiding labor pain, though that can be part of it. For some, it reflects this deep-seated feeling of lacking control, maybe not trusting their body.
And the C-section feels like the only way to manage that overwhelming anxiety.
Precisely. It's perceived as safer, more predictable, and while that decision is understandable given the fear, it obviously has its own set of implications. So getting to the root cause is really important.
And it seems like the fear of pain itself is a really central piece for many people with tokophobia.
That's right. The fear of labor pain is often a core component. And sometimes this connects to a more general, heightened sensitivity or fear around pain in other situations too.
Like a lower pain threshold generally.
Perhaps, or just more anxiety about experiencing pain, plus a previous difficult birth experience, maybe one with really intense pain, or where someone felt the pain relief wasn't adequate, that can unfortunately make someone more vulnerable to developing tokophobia later on.
Like a trauma response almost.
It can be, yeah. That negative experience really casts a long shadow.
This brings up an interesting point from our sources about primary versus secondary tokophobia. Can you break that down?
Sure. So primary tokophobia is the fear experienced by women or individuals who have never actually given birth before.
Okay.
This fear might crop up even during adolescence or maybe during a first pregnancy. It's a fear that isn't based on their own direct childbirth experience. It could come from stories they've heard, media, maybe just a general unease about the whole process.
The unknown.
Exactly. Fear of the unknown.
And secondary tokophobia then obviously has a different starting point.
Right. Secondary tokophobia develops after someone has already had a baby. It's often rooted in a negative or sometimes even traumatic experience during that previous birth.
Like what kind of experience?
It could be anything from, say, a perceived danger to the baby's health, maybe an emergency C-section that felt chaotic or scary, or even just feeling really unsupported or unheard during labor.
Yeah, that feeling of not being listened to can be huge.
Absolutely.
Yeah.
That whole experience can leave a significant emotional and psychological scar, basically, fostering intense fear about doing it all again.
It's clear the reasons behind tokophobia are super personal. But are there any sort of broader factors or common threads that might make someone more likely to experience it?
Well, while every person's story is unique, our sources do point to some contributing factors, things like not having a strong social support network.
Feeling isolated.
Exactly. That can really amplify anxiety during pregnancy. And there's also a noted link between existing mental health stuff like high stress levels, depression, generalized anxiety disorders, and a higher chance of developing tokophobia.
So underlying vulnerabilities can make it worse.
It seems so. The huge physiological and emotional shifts in pregnancy can feel even more overwhelming if you're already dealing with anxiety or depression.
Okay, so if this fear is so powerful and can really take hold, what are the potential risks if it isn't recognized and addressed properly?
Unfortunately, yeah, the consequences can be quite serious. Our sources suggest that unaddressed tokophobia might actually contribute to things like prolonged labor.
Really? How?
Potentially because increased tension and anxiety can interfere with the body's natural labor processes. There's also a higher chance of complications during childbirth mentioned.
Okay, that's significant.
And perhaps even more worrying is the established link between tokophobia and developing postpartum depression, or even PTSD
Post-traumatic stress disorder.
from childbirth.
Yes, that intense fear and anxiety around the birth doesn't necessarily just disappear afterwards. It can unfortunately continue to impact mental well-being long after the baby arrives. Wow. This really drives home how crucial it is for doctors, midwives, everyone involved in prenatal care to be aware of this. Are they generally good at spotting the signs?
Well, the sources suggest that unfortunately tokophobia can sometimes fly under the radar. It might be overlooked by medical professionals.
Yeah, is that?
Mm.
Maybe dismissed as just nerves.
Possibly. Or maybe the person experiencing it finds it hard to articulate the intensity of the fear. That's why open, honest communication is just so vital. If someone is feeling these intense fears, it's really crucial to talk about them proactively with their obstetrician, midwife, maybe a therapist.
So speak up.
Definitely. Early recognition is really the key to getting the right kind of support.
And what kinds of support or treatments have actually been shown to help people dealing with tokophobia?
There are actually quite a few psychological interventions that have proven helpful. Psychoeducation is one.
What's that about?
Basically, providing accurate information about the birthing process. It helps tackle misconceptions, builds understanding, maybe demystifies things a bit.
Makes sense. Knowledge is power.
Right. Then there's cognitive behavioral therapy, CBT, that gives people tools to challenge those negative thought patterns and develop coping strategies for the anxiety.
Practical tools.
Very practical. Enhanced midwifery care is another one. Having that continuous, trusting relationship with a consistent midwife can provide huge emotional and practical support.
Yeah, I could see how that continuity would help.
Definitely. And other approaches like psychodynamic therapy and even EMDR, eye movement desensitization and reprocessing have shown promise for some individuals too.
EMDR. That's often used for trauma, isn't it?
It is, which makes sense if the tokophobia, especially secondary tokophobia, stems from a traumatic birth experience.
So it sounds like there isn't really a single magic bullet, which makes sense given how personal this fear can be.
Exactly right.
Mm.
Because the specific triggers, the underlying anxieties, they can vary so much from person to person. So it's really essential that the support is tailored.
Personalized care.
Yes. A personalized approach is much more likely to hit the mark and effectively address the unique parts of their fear.
It's interesting to see how our understanding has evolved. You mentioned that year 2000 was kind of a turning point for formal recognition.
Yeah, that paper in the British Journal of Psychiatry was really important. It helped highlight that this level of fear wasn't just, standard worry. It was a significant, often under-recognized psychological issue that really needed specific attention and research.
And research is ongoing.
Absolutely. Since then, research has continued to investigate and refine different treatment approaches, always aiming to better support people experiencing tokophobia.
Okay, so as we wrap up this deep dive on tokophobia, what are the most crucial takeaways for you? What should people remember?
I think the main thing is understanding that tokophobia is real. It's a genuine, often debilitating fear of childbirth, and it affects a significant number of people.
Not just jitters.
Not just jitters at all. It goes way beyond typical pre-birth anxiety, and it can have real consequences for the birth itself and for mental health afterwards. And this is the hopeful part, increased awareness, plus the availability of these different therapies we talked about, offers real hope and effective support.
So recognition and treatment are key.
Absolutely. Recognizing the seriousness of the fear and knowing that help is available and effective.
It really does shine a light on how what might seem like just nerves from the outside can actually be a much deeper psychological challenge for the person experiencing it.
Exactly.
And as we've discussed, there are different ways this fear shows up, different potential origins, and importantly, effective ways to manage it.
Precisely. It shifts from understandable worry to something causing significant distress. And its potential impact, both on delivery choices and postpartum mental health, really underlines why it's an important public health consideration.
So here's something to really chew on. Given how common tokophobia seems to be, and how much impact it can have, how could our healthcare systems maybe get better at proactively identifying people who are experiencing this intense fear?
That's a great question.
And how can we provide more individualized, effective support throughout the whole journey, pregnancy, birth, and postpartum? What kind of innovative approaches or different support systems could really make a difference for the people affected by this?